Hi, it's me again. My name is Keisha Williams. This is my daughter Serena Williams, and we're going to be demonstrating the controlled coffin. So, again, you're going to perform your hand hygiene as you enter the room, while you're going to knock on the door and you're going to go in. The patient says, come in. You're going to wash your hands, you're going to introduce who you are, and then you're going to do your verification. I will tell them my name is Miss Casey. I'll be your nurse today, and I'm here because we're going to be doing a little bit of huff coughing to help you, you know, just to help you with your coughing, because after surgery it could be a little bit difficult on the, especially if you had a surgery on your abdomen. It could be a little bit difficult to cough. Sometimes it hurts, and sometimes the patients try not to cough, but we want them to cough. So since we want them to cough, we're gonna teach them about controlled breathing. There's still gonna hurt, but we could show them how to do it in a controlled manner. So I just, go ahead and explain to her what we're doing. Before you explain to the patient what you're doing, you don't want to have them verify who they are, and then she'll tell me her full name and her date of birth. Full name and date of birth.
Hi, my name is Serena Cashel Williams. My date of birth is December 21st, 2011.
Thank you. And then you don't want to ask about drug allergies. Just anytime in the hospital setting, I feel like it really doesn't matter what you're in the room for. Just always verify those drug allergies. So I'll ask her to verify if she has any drug allergies, and I want to check her wristband so that I could verify that she is who she says she is. And again, if they don't have that wristband, you do want to have them obtain one, because it's essential, especially for scanning for medications and stuff. You do need that identification bracelet. So if they don't have one, you want to make sure that they get it. So we're gonna go ahead and start the video. I'm just gonna push this chair a little bit, and then I'm gonna tilt my camera down so we can see. I'm gonna have you scoot your chair a little bit backwards. Stand up. Okay, now sit. And then we're gonna tilt the camera. Go ahead. So when you're doing this, controlled coughing, you want to have them sit on the edge of a chair and keep both feet on the floor, or you could have them sit on the edge of a bed, but they still want to have their feet on the floor. So you're gonna scoot and put your feet on the floor. No, not your body. Just scoot your buttocks. Yeah. Put your feet flat on the floor. Make sure your feet is flat on the floor. Yep. So just have them on the edge of the chair, feet flat on the floor. So now what you're gonna do for me, sorry, is you're gonna lean just a little bit forward, not a whole lot, just a little bit. Yep. And then she's gonna relax. Make sure that you're relaxed. That you're relaxed. Relax. And then what I'm gonna have her do is you're gonna fold your arms across your abdomen or your belly, just like that. Don't squeeze your tummy. But if the patient just had surgery, keynote, sorry, sorry. If the patient just had surgery and they're in a hospital bed, you wanna give them a pillow to just put over their abdomen, and then they're gonna just slightly cross their hands on top of that pillow and the abdomen, and then you're gonna go ahead and teach them about that controlled breathing. So it's a little bit different if they're laying down and it's after surgery and they're wanting to cough. It's a different, whereas she's just sitting, folding her arms across her stomach, and then we're gonna do the controlled breathing that way. But in a hospital setting where they just had surgery, you want to actually give them a pillow so that they could spin that belly and just put their hands over that pillow, and then you're gonna go ahead and teach them how to do that controlled coughing. So it is the same concept moving forward, even if they are laying down from surgery, but it's just different techniques. Whereas she's sitting there laying, there isn't a pillow, she's not. She can if she just had something happen to the abdomen and she wants to kind of splint it with a pillow, but she doesn't. So we're just gonna move on forward. So she's gonna clasp her hands on her stomach so that it will help her. Are you comfortable like that? Is your hand comfortable? Okay.
Yeah.
All right. So she is breathing. She has clasped her hands up on her abdomen. She's gonna breathe in slowly through her nose. 1, 2, 3, and then when she breathes in slowly, she's gonna lean forward, and then she's gonna press her arm against her abdomen a little bit more, and then she's gonna cough 2 to 3 times with her mouth just slightly open. So she's sitting up, she's gonna take a deep breath in, she's gonna tilt a little bit forward, just slightly forward, and then she's gonna let that air out, and then she's gonna with cough when she lets that air out. So what that does is it helps to loosen up the mucus and it moves that air through the it helps to move the air through the lungs. So we're moving the mucus so that the air can move through the lungs. So she on the first cough, it will help her to do that. But then the next two, it will help her to move that mucus out. So we just want the mucus out. So again, she's gonna put her feet flat on the floor, fold her arms over her abdomen or belly, and then she's gonna breathe in for me, and then lean forward, breathe out, and cough. And then she's gonna do that again. So you're gonna sit back straight again. Now take your deep breath in. Deep breath in. Yep, and cough. Okay, well, would you be able to do that without me? Let's see you do it. Okay. Good. Good. Very good. Very good. And that is pretty much the controlled coughing. So if she was laying down and she just had surgery, it would have been the same concept. She would put the pillow right here. She'd just breathe in, hold it a little bit firmly, and and we want them to cough after surgery. You know, we want them to move that thing. We want them to open up those airways because, you know, surgery kind of puts everything to sleep. So we want to wake things up and we want them to cough. And I know coughing is hard when you're in pain, but it has to be done. But that is all we got for you on the controlled coughing. So thank you for watching.